When it comes to differentiating between ruptured appendicitis, appendicular mass, and chronic appendicitis, it's important to consider the clinical presentation, imaging findings, and laboratory results for each condition. Let's start with ruptured appendicitis. This condition typically presents with a sudden onset of severe abdominal pain, starting near the navel and then moving to the right, lower quadrant. Patients may also experience fever, nausea, vomiting, and signs of peritonitis, such as rebound tenderness, and guarding imaging, such as a CT scan, may reveal free air or fluid in the abdomen, indicating perforation. There may also be an abscess or phlegmon. Laboratory findings often show an elevated white blood cell count, known as leukocytosis, often with a left shift, indicating an increase in immature white cells. Moving on to appendicular mass, this occurs when the body walls, often inflamed appendix, forming a mass. Symptoms may be less acute than in ruptured appendicitis, with localized pain in the right lower quadrant, a palpable mass, and low-grade fever. Imaging, such as a CT scan or ultrasound, may reveal a mass in the right lower quadrant, which can be an abscess, phlegmon, or inflamed appendix. Laboratory findings may show a moderately elevated white blood cell count, sometimes normal depending on the level of inflammation. Finally, chronic appendicitis, while less common, presents with long-standing intermittent right lower quadrant pain, which may be associated with mild nausea or vomiting. The symptoms are generally less severe and not as acute as those of ruptured or acute appendicitis. Imaging may show thickening of the appendix wall, appendicular calcified deposits, or localized fluid, with findings often being subtle. Laboratory results may be normal or show slight elevation in inflammatory markers, depending on the chronicity and severity. In summary, the key differentiators for each condition are as follows. Ruptured appendicitis, acute, severe symptoms with signs of peritonitis and evidence of perforation on imaging. Appendicular mass, less acute presentation with a palpable mass and imaging showing localized inflammation or abscess. Chronic appendicitis, long-standing, intermittent symptoms with subtle imaging findings and minimal laboratory abnormalities. It's important to note that the management of each condition differs, with ruptured appendicitis often requiring urgent surgery, an appendicular mass sometimes being managed initially with antibiotics and drainage, and chronic appendicitis potentially being treated with elective surgery. So when it comes to diagnosing and treating appendicitis, understanding the differences between these conditions is crucial for providing the best care for patients.